Welcome back to She Can, where women role models and some men lead by example by telling their stories, their insights and lived experiences to guide you, all of you, because it's easier to be what you can see. And I'm delighted to be talking to Dr. Arielle Bayer today. Arielle, welcome to She Can. You are a reproductive endocrinologist and infertility specialist at CCRM Fertility in New York. You're board certified in obstetrics and gynecology and board eligible in reproductive endocrinology and infertility. You joined CCRM after completing your fellowship. You received so many awards for your academic work. You presented scientific research at numerous conferences and published articles in leading journals. You were also recognized as a Castle Connolly top doctor. Arielle, tell us a bit more about your journey and how you feel you got to where you are today.
Well, thank you so much for having me today. I can't wait to have this conversation with you, and I'm just honored to be here. I took not the most traditional path to medicine, I would say. I come from a family without any doctors or physicians that I knew growing up, but something about women's health and learning about our bodies and advocating for ourselves as women really spoke to me from a young age. I saw family members who had to navigate the healthcare system and struggled with their own personal health struggles. So when I went to college, I wasn't pre-med in the traditional sense. I wasn't planning on going to medical school. I studied medicine from a historical perspective, and I was a history major. So I was really fascinated in learning about medicine and health from all different disciplines. But after graduating school and going out in the world, and I worked in a more of a public health education role, I really saw the need for compassionate physicians who really could specialize and help women through the most vulnerable times in their life. So I decided to go back to school for many, many more years. And I took pre-medical classes first, and that takes several years and to accomplish and do that. Take more testing, apply to medical school. And then in medical school, really solidified that I wanted to be an OBGYN and pursue women's health. So that was my next step in the journey. You, after medical school, do a residency, which takes between 3 to 5 years, depending on the specialty you choose. And for OBGYN, it's 4 years of a residency program. After residency, if you'd like to subspecialize, which is what I decided to do when I found reproductive endocrinology and infertility, it's an additional 3 years of training there. So that was my fertility specialty that I accomplished after 3 more years. And then I recently joined CCRM New York, their fertility practice in 2022.
Arielle, it's such a long journey to become a doctor, isn't it? So tell us a little bit more for people who don't know what that means. What is a reproductive endocrinologist?
Yeah, so a reproductive endocrinologist is trained in OBGYN first in general. So that's everything in obstetrics and gynecology, everything in a woman's life from puberty to menopause. And OBGYNs do delivering babies, they do pregnancy, they do gynecologic routine care. But if you specialize in what we call REI, you really have a more deeper understanding of the endocrine system, all of the hormones and reproductive physiology of a woman, and also fertility treatment, which can mean everything from fertility preservation. So if a woman's interested in freezing her eggs for the future or creating embryos for future family planning, or if they've already been trying to conceive and are struggling with infertility, we are the experts to diagnose and come up with the best treatment plan for a patient, whether that be anything from helping with ovulation, insemination, or IVF and genetic testing as well.
As I listen to you, Arielle, I'm thinking 2 things. Can you paint a little bit the picture of what this infertility challenge is in this day and age? I think there is 1 in 6 women around the world who are challenged in the with their reproductive system. And what does that mean for you? I mean, you know, you come across as so lovely. I mean, I wish I had an obstetrician like you. I had a lovely man, but I remember the first thing he told me was, "This is the closest to death you will be in your life." And I was pregnant, and I was like, "What is he telling me? Is he crazy?" And he was lovely, but I mean, you know, I was so shocked. I remember thinking, what is he talking about? And so I think there is so much empathy and, you know, just dealing with humans in a way where you are very conscious of the situation that they're in. So I would love to find out more about the sort of skills that you have that make you good at what you do, but also talk a little bit about the challenge of infertility in this day and age.
Yes, sorry that that was your first experience with your obstetrician. I think it just speaks to how much we don't learn about our own bodies as we are young children and adolescents. I
Mm.
think traditional, reproductive education is just don't get pregnant, use contraception, and don't get a disease. But there's just so much more about our bodies that many of my patients have no understanding of when they first come to meet me. So I would love, to see that we can teach our young women more about how their bodies work, how reproduction works, how their menstrual cycles go, because oftentimes many patients come find us after they've been trying for months or even years and are struggling with infertility, when they may have, if they had seen us sooner or had a better understanding what was going on with their own bodies, they would have potentially had an easier journey. It's devastating to be the first one to explain to someone that they're not ovulating regularly. But back to your question, the women who come to me are a mixture. It could be women who have been struggling, like I mentioned, for some time and are ready or have been ready to start their families. Women who have already started their families, but maybe are struggling at an older age with their second or third child, or have a new diagnosis that recently came up. Many young women who are on birth control for many years, they don't know what their periods are doing
Mm.
naturally or what their bodies are doing naturally. So a lot of their diagnosis comes as a surprise to find out they have something like PCOS or endometriosis that was treated unintentionally for years by the birth control
Mm.
pill, which is a good treatment for those conditions. And then I have patients as well who are looking to start their families in a different way, either with donor sperm or donor egg or with a surrogate or gestational carrier. So there's so many different kinds of patients that we take care of.
Yeah.
And in
And I
terms of,
wonder what skills you feel you have, Arielle, that really make you good at what you do.
I think to be a good physician in general, but especially a reproductive endocrinologist and fertility specialist, you're meeting patients who are at a very, very vulnerable time. They're coming to you with a lot of stress, a lot of questions, a lot of hopes and dreams, and you want to be able to listen to them and understand them and give them space to share what they've gone through and what their goals are. When I was in my medical training, I was very fortunate to be exposed to lots of physicians in my role in my position, and you see everything. You see the good, you see the bad, you see the challenging, and there will be physicians that you really relate to and want to emulate their compassion and their demeanor with their patients. And there are some interactions that you would never want to, replicate for a patient. So I think you take with you, the kind of doctor and physician you want to be. And my goal is to make sure patients feel so comfortable to talk to you about anything, that they feel like they're emotionally supported, that they have what they need, because the journey is not easy. It can be very challenging. And just providing that support, not just physically, but emotionally.
Arielle, as I listen I hear you talk, I'm thinking, have you had really good role models along the way who have shown you those ways that you thought, I want to emulate that? I want to emulate that sort of, incredible demeanor or kind of language, or, all of the things that you use to hold the space for the patients that come through your door.
Oh, I'm so, so lucky and fortunate. In my training, I trained at NYU for my medical school and residency. And early on, I really, was drawn to women's health, but I was able to connect with a few mentors in the field of REI who I could they were women, they were
Mhm.
young, they had families that they were growing themselves and balancing their life and their work. And I was so lucky to learn from them and watch them, because had I not seen that example, I don't know if it would have even been possible. I think, especially when you come from a family where there aren't doctors in the family, or you don't have that example to see, being able to meet and connect with a mentor like that was so, so special for me, and just crucial. So I was very lucky to have that, and make you realize it is possible. It's not an easy journey, like you heard. There's a long, long years of training ahead. But when you see those examples and you see how they hold space for patients and how they talk to patients, you can really use that as a tool
Yeah.
when you're meeting with your
Yeah.
patient.
Arielle, and you are really trying to decode many of the issues that girls or women face. You're on TikTok, you're on Instagram, you talk about PCOS, you talk about endometriosis, you talk about all the sort of challenges that girls and women can face with their reproductive systems, and you're decoding it and putting it in very simple words and sound bites to create more education. As you said earlier, many of us walk sort of blindfolded, and then boom is the period that maybe we want to become pregnant, and then we realize potential issues we might have. Talk to us a little bit about that. You obviously are part of the system, but you must also want to be a solution for and have a bigger vision on what your role is, and the world that you want to see for girls and women.
Yeah, I thank you so much. I think it's such a challenge these days, because we want to educate women um, you know, with real information and evidence and basics, really, of how our bodies work, um, how to understand their own bodies, how to advocate for themselves. It's so important.
Mm.
But we're also in a world of such information overload that it can be very challenging for women to find the right resources, right? They're just bombarded with advertisements and sponsored ads and take this and take that. And so to sort of weed through that, to find a double board certified reproductive endocrinologist is truly someone who has the training and the expertise, is really important. Many years ago, when I was in training, a bunch of colleagues and I were just really learned. I mean, social media was in its infancy, but it was starting to pick up. We were trying to understand, who are the experts out there. If we do a search, a hashtag search for trying to conceive, TTC, or infertility, what profiles do we get? And we ended up, doing a more, in-depth search of those profiles. And I think less than 7 or 5% of them were truly reproductive endocrinologists and infertility specialists. A lot of people claim to be experts with maybe personal experience or their own, research and training. And I think you just have to be really careful what you learn out there. And keep in mind, all the advice online is very generalized. So my, what I push for patients to do is to really be an advocate for their own health, to meet with the doctor, to find someone who they trust and they like. It might not be the first person they see, but to try to learn about themselves early on and the best they can.
Arielle, so what top tips would you be able to give to girls or women that are thinking about becoming pregnant? What are the sort of very basic things we can all do to make sure that we are ready for that phase?
I think when you're starting to plan for conception and you're ready to start your family, um, you know, definitely see your OBGYN. It could be your general OBGYN. It doesn't have to be a specialist, but there's some basic health evaluations that are important to make sure that you're healthy, you don't have high blood pressure, that you're not at high risk for diabetes, that you and your partner, if you're going to conceive with a partner, that you both aren't a carrier for any overlapping genetic conditions. So there's and checking your immune status, making sure you're vaccinated against the sort of risky infections in pregnancy like chickenpox and measles. There's just some basic workup that's important to do before you're even ready to conceive. I think that's a good first step. And also understanding your cycles. So many women who've been on birth control for many years really don't have an understanding of if they ovulate regularly, if they have regular periods, if they have very painful periods. So just understanding your cycles, which might mean coming off of the birth control, when you're ready to see and track how it's going. There are some more in-depth fertility evaluations that can be done if you have sort of previously known conditions, right? So that could be additional testing, but that's really where I think women should start.
Yeah, and really understand the position that they're in so they can take the right course of action and not all of a sudden think, oh my God, it's not working.
Right.
Yeah.
Right. And traditionally, they'll say try for 6 months, try for 12 months. But the truth is, if you're with a partner who's had sort of a known male factor infertility issue, or you and your partner have underlying genetic carrier conditions that you're going to want to screen your embryos for, or if you have a history of some surgery or something known about your uterus or fibroids, that you should see a doctor sooner than that amount of time, because you're not giving yourself a fair chance even after months of trying.
Yeah. Arielle, so how do you lead? What kind of a leader are you in your field? How do you show up as a leader?
So it's really seeing the patients that I see every day. It's on an individual level, but I do, feel that the empathy and my ability to connect with them is what helps as many people as I can, even in a small way. I just really connect with my patients. But then also I love to mentor those who are looking to go into medicine, young women who are considering the field. I just, outside of work, just on my own, love to talk to them about what life would look like and what's possible and what's out there, because it's so important to see sort of the broad breadth of ways to have a career in medicine. And it doesn't always look as it did in a traditional sense these days. So yeah, I think in those ways, at an individual level, meeting with people, it's how I show up every day.
Yeah. Arielle, and what are your challenges? Are there challenges? How do you reframe them? How do you overcome any sort of, difficult situations in the field that you're in? That could be both personally and professionally.
Yeah, there's always going to be challenges, and I'm sure everyone's familiar with those. Life comes at you and you are never prepared for it. And I mean, I can think of a specific time, and I was in my medical training at like the end of my residency. It was my chief year, the very end, and you have a ton of responsibility at work. You're leading a team. You have junior residents beneath you. You're taking care of a huge patient load. You're responsible for at the hospital. And I had a family member that got really sick. And it was like a huge, slap in the face to have to face, and a huge amount of responsibility. I also at the time had a young child at home, and it really made me realize that your village around you, whether that's your colleagues, your family, your friends, your partner, is so important. And to ask for help when you need. It's okay to not do everything. I had to say no to things. I had to ask for help. I'm so, so, so grateful for those who were around me at that time who helped me get through that very challenging moment. That's the balance of life, right? The work and the professional and all these and the personal, all these things that you're holding up, at all these plates you're spinning at once. So, women in medicine have to realize that they can do it, but they have to have a wonderful support system and to surround themselves with people who are going to uplift them and help them in times.
Yeah, I'm so grateful you said that, area, because I think there is a lot of girls and women that are still feeling that they need to be this perfect, alone ranger, and actually hardly ever can we do it alone. And this asking for help is still a real major barrier. And so I always love when our role models talk about that. So what are you most proud of to date, would you say?
If I had to pick, I would say one of the most my proudest achievement is my children and my family. I know have accomplished all these things professionally, and I'm so proud of the work I do on a day-to-day basis, helping my patients achieve their dreams. But at, if I had to like put everything in one pile, I would say my kids. I have two young boys, and there's no prouder thing than being their parent and watching them grow and develop, and raising them to see women like myself. I know how proud they are of me in return. That's my most proud achievement.
Arielle, and you alluded to that a little bit already. What do you feel? What is sort of sacred to you? What are the habits that are sacred to you to be able to show up as your best self?
Some sacred habits, I would say, are making sure to take care of yourself as best you can. And that could be in so many different forms, right? If it's getting a good night's sleep, it's very challenging sometimes with young children. If it's, doing something for yourself after work one day, prioritizing some self-care, that whether it's seeing a therapist or it's exercising or choosing to take a different route home that's going to, give you some joy. There was a physician in medical school who said this to me, and it was after a very, very difficult case we saw. A very, very sad tragedy occurred, and we all met together to debrief. And the first thing this doctor said to us all was that you cannot forget the heart pumps blood to itself first. And I always remind that to myself. My partner reminds me about that quote. And there's the coronary artery, it comes off the heart, but it comes right back to its own muscle. So before the heart pumps blood to any other organ in the body, the first pass of blood flow goes right back to itself. So in order to show up for your patients and your family and your siblings and your parents, you really need to take care of yourself. And it changes what that looks like from time to another. Right now, I try to carve out a tiny bit of time to go to the gym and work out, because I hadn't been doing that for years. So that's like my new favorite thing to do. I do it on Thursday mornings. It's early in the morning, but I take that time and space for myself. I I think it looks different at different times of your life, but it's so important for that mental clarity and that ability to face all the challenges that come up throughout one's day.
Definitely. Arielle, so what are your plans and your goals for this year and beyond? What is sort of your vision for the next years?
Well, I'm, excited to continue to provide, empathetic, compassionate care to my patients and help them achieve their goals and their dreams of growing their families. But my real goal, my hope would be to make reproductive care accessible universally. Right now, in the U.S., it's not. It's really in its infancy of becoming more accessible to everyone. There's states that mandate coverage, but there's a lot of loopholes that make it challenging to afford. There's hard to access doctors in certain parts of the country in certain states. I would, love to see a future where everyone made their reproductive health just part of their routine primary care health, right? To understand their ovarian reserve and their cycles as just part of their regular checkups. That would be a dream. And it's not just for women. I want men in the future to have the space for that. And I want men like my own sons who understand what I do for work, and allow women to plan and create their families no matter when or how they want to do that. That would be the ultimate goal.
Thank you for painting such a beautiful vision, and really a vision that we don't necessarily see in many places of the world right now. So I'm so thankful you said that. What takeaways would you like our listeners to have from your story?
Well, I would love for everyone to, first of all, just be very proactive about your health. Um, you know, like I said, fertility should be part of routine healthcare, but it shouldn't be an afterthought or something you come to as a last resort to learn about your body, your cycles. Ask family members, first degree family members, about their history. Women, sometimes they're surprised to find out their mother or maternal grandmother went through menopause early or had infertility struggles. So if it's possible to find out that information from family members while you can, I think that's great. I want women to advocate for themselves. That could be in the workplace, in their personal life, at the doctor's office. Speak up and use your voice. It's so valuable not to be afraid to do that. And lastly, just to have a really strong village. Like I said, you're going to need a strong support system in your fertility journey, in your life journey. So surrounding yourself with people who are going to uplift you and empower you is the best thing you can do.
Dr. Arielle Bayer, I love this conversation. It is packed full of tips and insights and your lived experiences, and such a beautiful vision for the future. Thank you so much for joining me today.
Thank you so much for having me.